Hello everyone, welcome to Pediatrics by Dr. Anand. So in this session we're gonna talk about, I'll be asking you some 3 to 4 random questions. I'll be asking you some random questions and we'll try to answer them by the end. So the first question I have is like name two duct dependent congenital heart disease. Name two duct dependent congenital heart disease. So these are the daily updates which we do on our YouTube channel and on Instagram, and we'll try to update everyone with the information. So number one question is name two duct dependent. You are dependent on the ductus arteriosus for the circulation. So name two duct dependent congenital heart disease. Anyone? Very good. Yes. So hello. Yes. So most importantly, we have coarctation of aorta, one of the duct dependent congenital heart disease. Hello, Mr. Budding Doctor. We have got a beautiful follower by the name Budding Doctor. So, the two important congenital heart for duct dependent congenital heart could be a TGA, transposition of great arteries, or could be a coarctation of aorta. Again, it depends actually. It depends. The right sided obstructive disease could be a duct dependent, or the left sided obstructive congenital diseases could be duct dependent. Right sided could be like pulmonary atresia, pulmonary stenosis, they are duct dependent congenital heart. Left side, if I talk about, it could be a coarctation of aorta, which is a duct dependent congenital heart disease. Okay, so you should know that. Question number two, which is the fifth vital sign? Which is the fifth vital sign in cardiology? Can anyone tell me? Any random guesses? Fifth vital sign in cardiology. These are the clinical questions I'm going to ask you, which examiner usually ask in exams. Options are heart rate, respiratory rate, temperature, CRT, or SpO2. So what do you think? Anyone? Which is the fifth vital sign in cardiology? Is it the heart rate, respiratory rate, temperature, SpO2, or CRT? So what do you think? So yes, very good. Perfect. So remember SpO2. In general, SpO2, we say it is the fifth vital sign. Fifth vital sign. Okay. Third questions. 5 questions I'll be asking you. That's it. Third question. Suck, rest, suck cycle. If I talk about suck, rest, suck cycle, so what do you think? Which condition am I talking about? Suck, rest, suck cycle. Have you heard this word? Baby while sucking the breast, he gets so tired. He gets sweating, diaphoresis. He takes a gap and then he again starts sucking the breast. So which condition do we see suck, rest, suck cycle? Put your answers in the comment section if anyone knows this. So yes, perfect. So have you heard of TOF physiology, tetralogy of Fallot? In general, TOF physiology, the patient usually have a suck, rest, suck cycle. Suck, rest, suck cycle. Okay. One more question. Recently, one junior was asking me regarding the arthritis. Like if I ask you fever with joint pain, fever with joint pain and joint swelling, so what are the differential diagnosis? See, every question you have to think in a very clinical, analytical way. Okay, the patient has a fever, a 5-year-old with fever, with joint pain and joint swelling. So what do you think? Any random guesses? What do you think? People who are online, can anyone tell me? A patient has a fever, he has a joint pain and he has a joint swelling. So what all conditions can come to my mind? So okay, so the budding doctor says dengue. Okay, very good. So can we think of rheumatic fever? Have you heard the name rheumatic fever? There is some, a very important rheumatic fever patient had cough and cold, some prodromal symptoms 2 weeks back, and now he has come with carditis, polyarthritis. Yes or no? Very good. So yes, very right. So rheumatic fever is one of the differential diagnosis of fever with joint pain and joint swelling. Then also we have a budding doctor. He has told hemophilia. That's very wonderful said. Hemophilia also usually gets a monoarticular arthritis. Very good. So someone Arya Das, he's saying Sogia, systemic onset juvenile idiopathic arthritis. Very good. Yes, that is a very wonderful point. So anyone patient comes to with fever, joint pain and joint swelling, what all questions will you ask as clinical orientation? What all questions would you like to ask if a patient has a case of fever with joint pain and joint swelling? The first very important, do you want to ask, is it the large joint who are involved or it is the small joint who are involved? Hello, Dr. Faiz. Thank you. Welcome to Pediatrics by Dr. Anand. So, fever with joint pain and joint swelling. First question should come to my mind. Is it a large joint swelling or is it a small joint swelling? Number one, yes or no? Okay, yeah. Hello, Dr. Abdul. Thank you so much. So large joint. Anyone who can tell me small joint spelling? Have you heard the name of rheumatoid arthritis? Yes or no? Rheumatoid arthritis will have a small joint involvement like a swan neck deformity, buttonhole deformity. Have you heard those all names? Rheumatoid arthritis, small joint involvements, fingers, yes or no? Whereas rheumatic fever will have a large joint swelling. Okay, even hemophilia also, hemarthrosis, large joint. Then one more question comes to my mind. See, patient comes with fever, joint pain, and joint swelling. First question, large joint or a small joint, number one. Second question, how many joints are involved? Is it monoarticular arthritis? Is it a oligoarthritis or a polyarthritis? Yes or no? Monoarthritis, oligoarthritis, or polyarthritis? Have you heard the name? Very good. So Ashish is very right. So mono, is it only one joint involved? See, if it is only one joint involved, can we think of septic arthritis? It could be a sepsis. Can we think of tubercular arthritis? So that is very important. Please remember, okay, the patient is a case of rheumatic fever. If the patient is a case of fever with joint pain, with joint swelling, please remember number one, large joint or small joint. Large joint example rheumatic arthritis, small joint example rheumatoid arthritis. Then it is a single joint involvement or a multiple joint involvement. If it is a single joint involvement having monoarthritis, you can think of septic arthritis or hemophilia or tubercular arthritis. If it is a polyarthritis, migratory polyarthritis, rheumatic fever is our best choice. um, Polyarthritis, migratory, poly, fleeting type of arthritis, somewhere on this joint, somewhere or this joint, sometimes on the left knee joint. So migratory polyarthritis is seen in rheumatic fever, and they don't have any residual defects. Okay, there is no residual weakness if I talk about arthritis in rheumatic fever. Okay, are you understanding? What are the other causes? Have you heard of sickle cell crisis? There also patient can have arthritis. The other problems like leukemias, malignancies, yes or no? Have you heard of reactive arthritis? Have you heard of infective endocarditis? Yes or no? So these are the very beautiful and very important names you should know in case of fever with joint pain and joint swelling. Okay, that's it. So this were the small glimpse of thoughts which I gave you. Every day we'll try to talk about some case or some random things so that it will be beneficial for you. Thank you so much for watching these small podcasts and small videos. So today we spoke about fever with arthritis. Then I had asked you regarding one very important question of duct dependent congenital heart disease. With the answer is TGA. The answer is coarctation of aorta and much more. Then I ask you suck rest suck cycle. We see in tetralogy of Fallot, which is a congenital cyanotic congenital heart disease. So these were the important questions which you should know for the daily updates. Thank you so much for the participation, and you can join our free WhatsApp group on 9999897081 for pediatrics revision, and have a wonderful day ahead. Thank you.